So type 1 diabetes is when your body's immune system decides your insulin cells are germs and slowly starts knocking them off. This is a process that happens over years, and by the time you get symptoms, you've destroyed nearly all of your insulin cells. The signs of diabetes are being very thirsty, passing a lot of urine, losing weight, feeling tired, and it can come on at any age, but it is commonest in children and young people. If that isn't recognised early, you can, by the time you realise you've got diabetes, be really very unwell and can end up with something called diabetic ketoacidosis, which is a very serious problem where high glucose levels lead to a dangerous build-up of acid in the blood. And around about 25% of people we see who are newly diagnosed with type 1 diabetes will come in diabetic ketoacidosis, which means they have to stay in hospital for longer, and it's often more difficult to get their diabetes sorted out. So type 1 diabetes is becoming more common, and the current estimate is around about 4 in 1,000 children and young people will develop type 1 diabetes every year. To give you a bit of context, in Nottingham, that means we see around about 50 newly diagnosed children every year with type 1 diabetes. So the ELSA study is looking to see whether we can find out people who are at risk of developing type 1 diabetes before they get the symptoms. And the idea behind that is to try and screen children between the ages of 3 to 13 for the antibodies that your body makes against the insulin, so that families are aware that there is a risk that their child might get diabetes and know what symptoms to look out for. What we are hoping is that if families are aware of that risk of diabetic ketoacidosis when you're first diagnosed will be reduced, and so you won't end up anywhere near as sick. The other thing that ELSA is hoping to do is we, at the moment, don't have any treatment to prevent diabetes, but about 2 weeks ago, a new drug was licensed in the States, which we hope will come over to Europe at some stage in the next year or so, which we may be able to use to stop people from getting diabetes. But unless we know people have got those antibodies, we won't be able to pick them up. And the only way we can do that is by this screening test, which is what the ELSA study is all about. So we're taking part in the study. This study is being run by a team in Birmingham, and we're helping out to try and recruit as many children and young people as possible to take part. We're looking for children and young people between the ages of 3 to 13, and we're opening it up as a starter for members of the family members of people who work at Nottingham University hospitals. What the study will involve is a finger prick blood test for the children, which we will test for antibodies and then let people know if any further tests are needed thereafter. So there have been other studies like this across the world. There hasn't been one with quite such a large remit where this is going out and testing the broad population. There have been studies previously where they've targeted family members of people who are known to have diabetes, because we know there's a slightly increased risk of getting diabetes if you have a parent or a sibling with it. But this is the first one that's run in the UK. A study in Germany done a few years ago targeted younger children and testing them as part of sort of general health screening, and they were able to show that they reduced the risk of children coming into hospital with diabetic ketoacidosis from 25% to 2%, so it was very successful. So it would be fantastic if anybody has children between the ages of 3 to 13 and they'd like to know if they are at risk of developing type 1 diabetes, they can get in contact with us in the Children's Research Team, and we're hoping to have some stalls set up around the hospital in the new year where people can come along and register their children. We'll do the blood tests for them there and then, send them off, and then be in contact with them with the results in due course. So we have some information sheets which we will put up on the Trust website, and also otherwise they can contact the Children's Research Nursing Team, which are, there's a generic email for them on the intranet. So I'd just like to say that we're really excited to be taking part in ELSA. At the moment we're doing it because we're hoping to reduce the number of children and young people that come in really unwell when they're newly diagnosed. But if this study is shown to work, then this is something we're hoping might be able to be offered to every young person in the UK. And ultimately, if we do have treatments, it might mean that we can actually prevent type 1 diabetes in the future.